T-Complete Care is a step-by-step solution to ensure effective TEE probe reprocessing. CS Medical provides the T-Complete Care Suite as another tool designed to help minimize healthcare-associated infections. Let's discuss each step in the T-Complete Care program. T-Complete Care offers the necessary tools to promote an effective process for handling soiled TEE probes. Step 1. Bedside clean the soiled TEE probe as soon as possible, once removed from the patient's esophagus. T-Zyme enzymatic sponges provide a simple and effective method for enzymatic application to the TEE probe insertion shaft directly after removal from the patient's esophagus. T-Zyme sponges are pre-saturated with an enzymatic to begin the process of breaking down bioburden. Step 2. Transporting the soiled, potentially hazardous TEE probe throughout the healthcare facility. T-Porter transportation device is both a procedure case and a transportation case for the TEE probe. The procedure case is set up to support the TEE procedure, as well as provide the necessary tools to properly bedside clean and label the TEE probe during transportation within the healthcare facility. T-Porter provides a safe and secure method to move the soiled TEE probe throughout the healthcare facility. The pull-up biohazard cover along with the two red tie bands properly identify the soiled TEE probe as a biohazard. T-Porter is not a storage device. Step 3. The TEE probe manufacturer recommendation is to clean the probe prior to high-level disinfection with an enzymatic detergent solution. Metazyme LF is a mild low-foaming enzymatic solution that is optimal for this process. Metazyme LF should be dispensed per label instructions into warm water. After cleaning with Metazyme LF, a rinse is required to remove residual enzymatic solution prior to HLD. Step 4. Drying of the TEE probe before high-level disinfection. The drying of ultrasound probes is recommended by chemical manufacturers and governing bodies. A wet TEE probe could affect the concentration of the high-level disinfectant and potentially dilute the disinfectant. Quick-dry drying cloth is a contaminant-free, single-use, gamma-irradiated woven fabric that slides freely down the insertion shaft of the TEE probe. Step 5. Per the IAC recommendation, all TEE probes should be electrically leakage tested between patient uses. CS Medical offers the ability to conduct electrical leakage testing inside the disinfectant reservoir, thus minimizing the need for additional containers of liquid to accomplish this requirement. By conducting the leakage test inside the automated disinfector, you minimize probe handling that could result in damage to the transducer. The HLD tracker can be used to document the successful completion of this requirement. Step 6. High-level disinfection of TEE probes. The TD100 automated TEE probe disinfector high-level disinfects a TEE probe in 5 minutes and then rinses any residual disinfectant free of the probe before alerting the end user a successful disinfection cycle has been performed. The TD100 is FDA cleared for use with either TD5 or TD8 high-level disinfectant. During the disinfection process, the TD100 constantly monitors disinfectant contact time and temperature. And at the conclusion of a successful cycle, the verification report is generated and can be logged in the HLD tracker for later reference. Step 7. Rinsing of the TEE probe is required to remove any residual high-level disinfectant. The TD100 only requires the use of high-quality potable water to perform this step in the reprocessing of the TEE probe. In the event your facility has a questionable water source, the Nephros Ultrafilter is an FDA-cleared medical device that offers 5 nanometer water filtration and removes potential hazards found in your water supply. The Nephros filter is a patented dual-stage hollow fiber water filter that retains bacteria, viruses, and endotoxins found in water. Step 8. Drying of the TEE probe after high-level disinfection and rinse. Quick-dry drying cloth is a contaminant-free, single-use, gamma-irradiated woven fabric that slides freely down the insertion shaft of the TEE probe. Packaged in an easy-to-open chevron pouch, the cloth removes residual moisture and does not introduce new contaminants to the high-level disinfected TEE probe. Step 9. TEE ultrasound probe storage. TEE ultrasound probes should be stored in a dry environment, hung vertically, and within a HEPA-clean cabinet. The Clean Shield TEE ultrasound probe storage cabinet allows healthcare facility compliance with the Joint Commission standards of care. CS Medical provides the Clean Shield ultrasound probe storage cabinet, which bathes the high-level disinfected TEE probe with constant positive pressure HEPA filter airflow. Step 10. Transporting the high-level disinfected TEE probe to the procedure room. T-Porter transportation device is both a procedure case and a transportation case for the TEE probe. The procedure case is set up to support the TEE procedure as well as provide the necessary tools to properly bedside clean and label the TEE probe during transportation within the healthcare facility. A high-level disinfected TEE probe can be removed from the Clean Shield and placed into the T-Porter to allow for safe and secure transportation throughout the healthcare facility. The high-level disinfected TEE probe is placed in a plastic sheath prior to being loaded into the T-Porter. The T-Porter has specially designed compartments for the different parts of the TEE probe. Once loaded into T-Porter, green tie bands, labeled Clean, are used to secure the lid to the case and ensure that the TEE probe does not fall out. As you see, the T-Porter procedure case is complete with all the necessary items to use the probe and to follow the steps of reprocessing per current guidelines. CS Medical and T-Complete Care, providing a step-by-step solution for the effective reprocessing of TEE ultrasound probes. CS Medical is a leader in developing, manufacturing, and marketing medical devices that are designed to provide high-level disinfection of ultrasound TEE probes. Our products are engineered and developed with one single objective in mind: to minimize the potential of patient exposure to improperly reprocessed TEE ultrasound probes. Thank you for your time and your continued devotion to patient care, safety, and HAI reduction.